I'm Dr. Vivian Paintsil. I am a pediatric oncologist at the Komfanochi Teaching Hospital. I am also a senior lecturer at the Kwame Nkrumah University of Science and Technology, specifically at the School of Medicine and Dentistry. I have been into pediatric oncology from 2012. I completed my education, my subspecialization in 2013. And since then, I've been heading the pediatric oncology unit. And some of the things that I've been able to do is that I was able to get new guidelines in terms of the treatment protocols for pediatric oncology, and then also have been able to establish a very robust pediatric tumor board meeting. And so currently we have the multidisciplinary team, which is working very well. So if you ask me why I am into pediatric oncology, I would say that I thought that it was a challenge. And then for most of the time, lots of the patients were neglected. Because when I was doing residency, I saw that in my readings that for pediatric cancers, they had a good survival. But we didn't see that in our part of the world. We saw that most of them were dying. So I just was wondering, why were they dying? Is there something that we could do that could improve the survival? And so that is why I went in, because there were a batch of people that nobody even wanted to go and see, because it comes with lots of social, emotional issues. And so lots of people didn't want to go and look after them. And because of that, I thought that, well, this is an area that I think I can make an impact. And so I should be able to go there and make the required impact. So that is why I went into pediatric oncology, to make the impact that I think could be done. You know that for women, everywhere that we find ourselves in, especially in our part of the world, women are not supposed to speak out. Women we are sort of like, you are supposed to be like a second class. And so at times it is a bit difficult, especially even with the patients themselves. If you have people coming from certain tribes, they don't want a woman to even speak with them because they feel that they have to speak with the men. So there have been a few occasions that I will let some of my male counterparts possibly counsel some particular like parents, because you could get better outcome out of that. And that has been some of the issues that we face. Initially, it was very challenging, but I think that currently, with more people coming up, with more doctors subspecializing, I think that it is getting better. But initially, it was very difficult, especially when they feel that, oh, all your patients are going to die. And so whatever you say, nobody was listening to you. But I would say that currently, it is better. I decided to apply to LPWO because after looking through the profile, I saw that what they were going to teach was something that I needed. I was put into leadership position without any prerequisite knowledge or skill, and I had to struggle through trying to learn one thing from one website to another. And so with this training, I thought that I could acquire some skills and some knowledge which will help me to improve on my speaking skills, to improve on how I relate and I coordinate my team, and also be able to advocate better for the patient, because whatever leadership skills I have, it is all for the improvement of the outcome of our patients. And so that is why I went and applied for this LPWO initiative, and I think it was good also for me. So in low and middle income countries, one thing that occurs is that a lot of us, because there are very few specialists around, people are put in leadership positions without any knowledge or any skill. And so such an initiative will equip other people so that they can be able to do the job well. And then we are taught, and then we are mentored by women. That makes it very, very unique. and you see other women in high positions who tell you their stories, how they were able to climb up the ladder to where they are, advise us. And we have lectures also where we are taught different leadership skills and communication skills. And so that makes it very unique. Most of the time, you won't have all these leadership training for women. And so this is something that makes it very unique. And especially for in oncology, pediatric oncology, although they are women, it's most of the time we also have lots of men in there. And so if we have this just for women, then it sort of empowers our ladies so that the ladies can also do well in oncology. So in terms of applications of skills, we apply them a lot. There is one thing that I always remember being told, that when you climb up the ladder, you have to try and keep the door open for others so that others can climb up too. And that is something that I always try, so that the other women don't feel that they are disenfranchised. But we should be able, I always try to give them the equal opportunity so that they can also rise in their different fields of training. So it's not only in oncology, but in all the different things I do, in pediatrics, my residents and all that, so that I can be able to build up my skills and then the knowledge of our other ladies who are in the medical profession. So what I would say is that this is a very good project and program. And then others should all come on board. I would say that our women oncologists, whether you're an oncologist or in all the other fields that take care of people with cancer, if you're a woman, you should go up and apply, because it will enhance you. It will enhance your awareness. It will boost your self-confidence. And then it will help you, give you the soft skills that you need, so that you will be able to perform better as a leader. Even if you're not the one who is heading your unit at that time, wherever you find yourself, the soft skills that it gives you, it will help you so that you can perform better in that area. And so I will encourage everyone to go ahead and apply for this initiative.